the smear test film. A smear test is also known as a cervical screening test.
Let's draw the boobs a minute. Whereabouts are they? Hold on.
All these people came together to make this film because they want to help with something which is very important, but it can be difficult to talk about. Over 5 days, they all drew some pictures. They did lots of talking.
Feeling sad.
Oh yeah.
Acted in the film, shared their experiences, and laughed a lot to hopefully make something useful and get people talking.
You see me go in and have a smear and I come out saying it's all right, it's fine.
This film is about smear tests and why they are important. But first things first. What is cancer?
Cancer is where a small part of the body changes
It changes from what it should be.
and grows into something else.
If found early, cancer can be treated more easily. What is the cervix?
The cervix is the neck of the womb. The womb is where the baby grows when you get pregnant.
A smear test looks for changes in the cervix that might become cancer.
Which is why a smear test is so important to have done.
3,000 women get cervical cancer each year.
Unfortunately, 1,000 women die every year.
Most cervical cancer is caused by a virus. It is called human papillomavirus, or HPV. You can't catch it like a cough or a cold, and you won't know if you have it.
Lots of women with a learning disability are not having smear tests. So I hope watching this DVD, it will change your mind to go for a smear test.
Smear test film, scene 1, shot 1, take 1. Molly gets a letter.
Action!
My name is Teresa and my character's name is Molly.
Anything in the post?
Nothing really.
Have a good day.
Many people with learning disabilities find reading difficult and often ignore letters that arrive in the post. What problems could there be with a letter?
What do you do when you get an invitation and who can help?
I think it's probably very easy just to think, well, I'll deal with that another day and put it to one side.
Yeah, that's what I do. I
And
do
then
things
months
like
go
that. I do
past
that
and
one.
years go past.
That's what I've done, yeah. Oh, just take your nose and that. We'll just put that over for a minute.
Deal with it
But
another
now
day.
I've got Claire, I've got my Di's social worker. So I've got a support worker as well, so I give her all my posts and they sort it, read it to me, where it's got to go. That's good. So, yeah. My name's Sarah. In this film, my character's Dottie.
Yeah, hi, my name's Carly, and in this film my character's Lottie.
Molly works in the garden with her friends.
It's a nice lot of beans. My partner loves beans.
I haven't got a partner, but I like them.
Making an appointment.
Lottie,
This is a reminder for you to come for your smear test to make your appointment. Please call your GP.
why do I have to go?
It's just quite important.
I've had lots of smear tests, and it's just an examination to check you ain't got cancer. It doesn't matter if you've got a boyfriend or not, it's still important to go.
Could you help me ring them up?
Yeah,
Oh, thanks.
no problem. Hello, I'd like to make an appointment for my friend Molly Jones for a smear test.
Once you're over 25 years old, you're more at risk. More at risk of developing problems with your cervix. and it is worth getting checked out.
It's very important, even though if we've got disability or not, it's not to do with sex, it's to look after our health and look after our womb. It's a bit uncomfortable, but apart from that, it's got to be done. So yeah, it's really important.
It's a bit uncomfortable, but it's not that bad.
It is a bit uncomfortable.
Yeah.
Yeah.
It's very.
metal.
It's a metal thing. Yeah. Yeah.
Very cold.
Yeah.
Molly goes for her appointment.
Molly.
Hello Molly, I know you, don't I?
Yeah.
How's the day centre?
Fine.
Are you sure that you need a smear test?
Yeah.
I think I just need to go and check that out. If you could wait here, please.
Molly doesn't wait to find out if she is supposed to be here. She becomes flustered and leaves.
I know of somebody who's been called for a smear test, actually gone for one, and started to get ready, and the nurse has said, I'm not sure if that was supposed to do this, I've got to go and talk to someone, came back and then said, no, we're not going to do it because she's got Down syndrome. Off you go.
This is Claire. She is a nurse.
So, yeah, I mean, these stories are in the minority, but they can happen.
Can I have a word with you two now?
Why, what have we done?
Right, I went to the doctor's and I was left there standing there like a lemon.
Why, what happened?
The lady behind the desk didn't think I needed a smear test.
Everybody got to have a smear test.
Well, they're trying to help.
Apparently I don't.
Oh, what's the matter? She's got beer in her
I know she has. We'll go see her.
Later, Molly meets her support worker.
How have you been this week then, Molly?
Okay,
Oh, that's good.
but
But?
I had an argument
Oh, who with?
with my friends
Oh, what was it about?
about going to the surgery for a smear test.
Oh, okay. So, did you go to the surgery?
I got there and then I was all confused.
What happened?
I got told I didn't need to be there. I got all confused.
I suspect you did. Well, you should have been tested. So, did you actually get a smear test?
No.
Oh, I'm sorry that happened to you. I think what I'm going to have to do is ask Claire, the nurse, to have a word with the surgery because you should really have been tested. Does that sound okay with you?
Yep, that
Yeah?
sounds okay with me.
Brilliant. So if we get Claire to make you another appointment as well. Now, if you're nervous about that appointment, Claire could come with you, or I could come with you, or a partner or a friend could come with you.
A friend.
You prefer a friend,
Yep.
would you? Have you got a friend in mind?
Lottie.
Oh, Lottie would be great.
Here she comes. Oh dear.
Oh dear.
Hello.
Hello. Sorry for earlier.
Oh, that's all right.
So I'm friends after all.
I've been and had a word with Carla, and she said that I should go for the smear test.
Oh, that's good.
Do you want to come with you?
Yes, please.
That's a good idea. So we're all friends now then?
Yep.
That's
Oh,
good.
We all fell out, but we're all right now. That's good, isn't it?
That's good.
Yep.
You should have somebody with you and that they feel safe with to go for the smear.
Yeah.
And then when they're going through the smear, ease them, hold their hand and
Yeah.
say it's going to be okay. It's really important that you have this done.
The first time I was a bit scared. So my husband came with me.
I've had one friend that's refused, but I changed her mind. Yeah. So I actually, yeah,
How did you do that?
I actually went with her, went in the room with her. Yeah. I actually sort of persuaded her
That's good.
to go in. She had it done. I said that it wasn't so bad, and she said no, it wasn't.
Hello.
Hello, Molly Jones.
Oh, hello again, Molly.
I'm here with Molly.
Okay, if the two of you would just like to take your seats.
Don't worry about it, everything's going to be fine. I've had like loads of these done before.
Molly Jones, the nurse will see you in the treatment room now.
It's really important to have a woman, I reckon. Very much so, yeah. Because you feel relaxed with a woman than what you would a man. Because it wouldn't be normal, would it, for us women to have a man doing things like that?
It always will be a female nurse.
They've done it hundreds of times. They know what they're doing, and it's to help us ladies to prevent us getting cervical cancer.
What happens during the smear test?
Come in. Hello, Molly. Come in and take a seat. Oh, you've brought a friend with you. Okay, before we begin, we just need to check a few details. Is that okay?
The nurse will introduce herself. She will show you the equipment and talk about what will happen. She will ask you about your address and talk to you about your sexual health and contraceptives. She might also chat to you about the HPV virus.
Do you want to go and get changed?
Oh, we'll be fine.
Once you're ready, if you'd just like to sit up on the couch, okay? And then I'll come in and we'll do the test. That's it.
When you go for a test, it's easier if you wear a skirt.
Just going to adjust your skirt, okay? And if you'd like to relax your legs for me, okay?
Cut!
What happens?
Well, no, you just got to lie on the couch, put your knees together
Yeah,
like
like that.
this.
Yeah, like that.
Yeah, and then you get there to put that speculum. This is a speculum. Years ago, it used to be metal.
Yeah, they're not now.
They're not now. That's
Yeah, years ago, it used to be metal. I remember.
These are the beasties. It hasn't been used, don't worry.
I know, but they look horrible. Ah. You don't really see it going, do you?
Oh no, because you're let down.
Oh, yeah. You can do it yourself.
Oh, I would like to try, sorry.
This is a model that doctors and nurses use to learn how to do the test.
So we'll take the skin off.
This is Lynn from Public Health England.
In here, you've got your womb, which is quite small, considering it can hold a whole baby.
Yeah.
You've got your ovaries, which are like little tiny, I suppose they're like little walnuts. And then you've got your back passage, and then you've got your bladder that holds your wee. Okay?
Oh, Philip.
Oh,
Is that our womb, is it?
There's a bladder.
There was it. Where's our womb then? There. Oh, yeah. And there's our ovaries.
The speculum is placed inside, and a small soft plastic brush is used to do 5 sweeps of the cervix to take a sample that is sent off for testing.
It might be painful and you might have a bit of bleeding after, but that's normal.
It can take 2 weeks before the results come back. For most people, the results will be fine. If there is something wrong, it's good to know early, so the doctors can help.
Yeah. Has anybody ever had an abnormal
Yeah.
test? Okay. And what happened after that?
When I had Shauna's 20 now, I had cells dead and I had to have lasered out.
Yeah.
So I'm yearly now. I've got to have a smear every year.
And when you had to have the cells lasered, what happened then? What did you do?
Oh, I had to have regular tests.
Yeah.
Yeah.
Yeah. And did you have to go to the hospital?
Yeah. Didn't go to doctors, it took me straight out to go to the hospital. So, yeah. Since filming, I had to have a smear test. Now I've got my results in my hand. Everything's clear. Now I ain't got to have a smear test for another 3 years. So I'm happy.
Thank you for watching this film.
No one is going to force you to have this test.
It's your choice.
I hope you get the confidence and encouragement to go and have a smear test.
And don't be scared.
Most women will have a normal result. 9 out of 10 women will be okay and invited for another test in a few years' time. If you need help understanding your results, or if you are asked to go for further tests, you can always talk to your doctor, practice nurse or LD nurse. If you are worried about your smear test result or cervical cancer, Joe's Cervical Cancer Trust have a helpline you can call. If you need more help to understand any part of this test, please ask someone you trust. And thank you for watching.